are going to talk about Joe Biden and this new COVID treatment. It has been reported.
It says the U.S. government is committed $3.2 billion to help development of antiviral pills to treat COVID-19, officials had announced on Thursday. It says Dr. Anthony Fauci, the nationwide top infectious disease expert, announced the investment during a White House press briefing as part of a new antiviral program for the pandemic. And the money would be used to speed up the clinical trials of several pills, which would be used to knock the symptoms shortly after infection before patients become seriously ill. If trials prove successful, the first pills could be approved and available on the market by year's end. That sounds promising. It says of the $3.2 billion, $500 million will be spent on research and development, and $1 billion will be spent on preclinical and clinical trials. Another $700 million will go towards manufacturing through the National Institutes of Health and Biomedical Advanced Research and Development Authorities. A final $1 billion will be spent creating a new antiviral drug discovery, AVIDD, Centers of Pathogens and Pandemic Concern. It says several viruses can be treated with the pills, including HIV, hepatitis B and C, influenza, and even genital herpes. However, no such treatment exists for COVID-19 to help the body fight off the infection. Currently, remdesivir is the only drug fully approved by the Food and Drug Administration, FDA, to treat COVID-19, as well as several monoclonal antibody treatments approved for emergency use authorization, but all require injections. The new program, called the Antiviral for Pandemics, APP, will fill the gap in research for drugs to treat the disease. In an interview with the New York Times, which first reported the news on Thursday, Fauci said he looks forward to a day when someone who tests positive for COVID-19 can immediately go pick up pills from a pharmacy. I wake up in the morning, I don't feel very well, my sense of smell, tastes go away, I get a sore throat, Fauci said. I call up my doctor and I say, I have COVID and I need a prescription. Currently, several candidates are in trials around the world, including one from Pfizer, which is called PF 07321332 and belongs to a class of drugs known as protease inhibitors. It says the pill would work by inhibiting the enzyme that the coronavirus uses to make copies of itself in the human cells. It says in March 2021, Pfizer, which developed the first authorized COVID-19 vaccine in the U.S. with Germany BioNTech SE, said the antiviral candidate showed potent activity against the virus in lab studies. It's currently unclear how long the treatment course could be and how many times per day or per week patients would have to take the pill. According to Drug on the Government Radar at AT527, developed by Roche Atia Pharmaceuticals Incorporated, which is currently in phase 3 clinical trials. Last week, the U.S. Department of Health and Human Services agreed to purchase 1.7 million doses of molnupiravir, an antiviral pill made by Merck, for $1.2 billion if it is proven to work and receive FDA authorization. Early stage trials showed that the percentage of patients who were hospitalized and or died were lower in the molnupiravir treated group compared to the placebo group. During the press conference, Fauci also said APP will work to innovate new therapies for other viruses. There are few treatments that exist for many of the viruses we have that have pandemic potential, he said. Okay, so I guess they're back tweaking shit and they're back out playing with science and whatnot. So we'll see what happens with this, man. I don't know how y'all feel about it, but maybe some people may be more comfortable actually just taking a pill than actually having to go and get it, take that damn vaccine. So I guess that would help us to better fight the virus, because there's still such a large portion of people who are not vaccinated and just, I guess, basically refuse to get vaccinated because they don't trust the government and or the scientists. So I guess maybe people would be more inclined to actually taking the pill. I think I would rather, personally, I wouldn't mind going to be able to pick up a prescription if I caught COVID like anything else and pop a few pills and be good with it. I guess it just depends on how we've been prone, and some of us been prone now. For some reason, you just assume or it feels like that'll be more safer, but it may not be. So, you know, pills and shit like that could be just as dangerous, but it'll be interesting to see how this research turns out. Because again, there's a lot of people that's not going to take that just against taking that vaccine.